Hello and welcome to A Closer Look. I'm your host, Lynda Fontaine. Today my special guest is Dr. Swathi. She is an integrative pharmacist. Thank you for being here today, Dr. Swathi.
Thank you so much for having me.
Now this is interesting. This is going to be a really neat bit of information because you're going to be talking today about popular drugs right now, Ozempic and Wegovy. And you're going to tell us some of the side effects. Talk to me about this.
Yeah, so GLP-1 agonists, this is the class of medication you're talking about, is actually a hormone that we naturally produce in the body. And so the idea is that if we use these drugs, it can help us, or it can help patients with type 2 diabetes or obesity. But what a lot of people are not talking about are some of the misconceptions surrounding these drugs. The first one is that it's a magic bullet and it's going to work for everyone. Mm-hmm. And then the next one is that it's free of side effects, but there actually are some major red flags to look out for.
And that's interesting because I was just talking to someone recently about how it is so good for so many people. That's like a wonder drug almost, in that it not only will help you lose weight, but it does all these other great things for you. But you're telling me there's also things we should be more concerned about, and that's what I appreciate, because oftentimes we just hear one side. So talk to me about some of these red flags. You said there's like 4 of them that are critical, right?
Yeah, so I would say there are 4 red flags. There's one related to, gastrointestinal issues, so stomach issues, one related to the accelerated muscle loss, one related to off-label use, and one related to muscle health.
Well, talk to me about the first one. Talk to me about the gastrointestinal issues.
Yeah, so, when people are taking this medication, one of the top side effects is issues with your stomach. So that could be nausea, vomiting, constipation, diarrhea, and potentially issues with the stomach not emptying properly. And that could lead to chronic digestive problems.
All right. So do you see a lot of this? I mean, is it just rare, or is this more common than we think and they're just not giving us this information?
So it is more common than we think. And so it's just surprising that people are not talking about this. But they're also, the red flag that I'm most concerned about is the accelerated muscle loss.
Yeah, talk to me about that, because people are working out, they're trying to lose weight, so they're still losing muscle even though they're working out because they're taking the drugs, or how's that working?
Exactly. So the way that these drugs work, of course, people do lose up to 15% of their body weight, but that weight loss is a combination of fat and muscle loss. Mm-hmm. And a lot of the new research is showing that muscle loss is what is attributed to longevity. So if we want to be healthy and age powerfully, we need to think about, what are we doing to support and preserve our muscle?
Well, what can people do if they're taking these drugs? Do they just need to work out more, eat more protein? What should they do?
So I think it has to be a multifaceted approach with nutritional interventions. So that could be, eating smaller, fewer meals. Also, as you mentioned, movement. So thinking about strength training, aerobic exercise, so going out for a run, going out for a walk, walking the dog. But also I know that we lead very busy lives. Mm-hmm. And so, we could be trying all of that, but I also like to recommend 3 supplements that are helpful in supporting muscle health, especially for people who are taking GLP-1 agonists. So the first one is omega-3 fatty acids that can reduce muscle inflammation and support protein synthesis. The second one is amino acids, specifically branched-chain amino acids, and those can actually prevent muscle breakdown. And the third one is one that you might not have heard about because it's newer, but it's highly studied, and it's called Fortetropin. It's a natural compound derived from fertilized egg yolk, and in a clinical trial, it showed that it boosted muscle protein synthesis by 18% in adults who are not exercising. So if you want to see more about this study or other studies, you can check them out at myosmd.com. So it's myosmd.com. I'm one of the medical advisors for Fortetropin. So I've also uploaded some educational videos on that website to learn more about how people can safely use GLP-1s.
Okay, you need to spell that for me. The Fortetropin.
Yeah, Fortetropin. So Fortetropin.
Okay, I gotta look into that. But you say that's on a website, right?
So you can find more information and studies about Fortetropin that have been done in a number of different patient populations on myosmd.com, myosmd.com. And I also post educational videos and interviews with industry experts about how we can help our patients support muscle health.
Very good. Now, talk to me about mental health side effects.
Yes. So that's another thing people are not talking about enough, is that these GLP-1 agonist drugs can actually impact mental health. And so one of the key ways is that the way that this medication works in the body is that it can impact the brain's reward system by reducing appetite, right? So if we don't feel as we're taking these medications, we experience satiety or fullness quicker. And so this impacts the way that, it can shift our mood, and it can, get in the way of things that we used to find exciting, but are no longer, as exciting to us just because of the way that the drug works. So it could be tied, yes, to mood swings, but also elevated anxiety or low mood like depression.
So if someone stopped taking these drugs, do those problems go away?
So they could, but the thing is, GLP-1 drugs, as they currently are FDA approved, are meant to be taken long term. So the idea is that you don't take them and then stop them once you hit your target weight, for example, because there's also a phenomenon called rebound weight gain. And so once people have stopped taking the drug, they're gaining back the weight and sometimes even more, in addition to, some of these mental health issues.
So the rebound, is it just because you're so used to taking the drug that your body just kind of reverts back to the way it was and you just have these cravings, or is that something that is a side effect of the drug?
So it's because of the way that the drug works. If you're taking it for a long time, you're teaching your body, you don't need as much food, you're full enough on this. But once you stop taking the drug, you go back to the way that you used to eat, or the way that you used to feel hungry. And so it's just the drug is kind of substituting in for this hunger. And then after, you go back to the way it was before.
Well, can you give us some recommendations? What can we do instead?
Yes. So instead of taking the GLP-1s, is that what you're asking?
Correct.
Yeah. So instead of taking the GLP-1s, I always say that when I'm working with patients, the weight loss entire experience is a journey. And so it's about how can we incorporate these lifestyle changes into our daily life so that we can sustain this and have it be something that is, something we can maintain. And so starting from the beginning, how can we eat things closer to the perimeter of the grocery store? So thinking about produce and eating the rainbow, finding foods that you like, because you might not like all vegetables, which is fine, but finding some fruits and vegetables that you really do like. And then thinking about what movement you really like. Again, like some people love HIIT training, some people love, Pilates. It's trying to find what you really like and what resonates with you, and creating that more personalized approach with which, as an integrative pharmacist, that's something I'm really passionate about, is helping patients figure out what is going to work best for them and help them achieve their specific treatment goals.
Well, we have about 2 or 3 minutes left. Is there any last little pearls of wisdom or information you would like to concentrate on or make sure we understand regarding this?
Yeah, so that weight loss is, something that's not going to just happen overnight. It's something that we need to all work towards. And if you choose to take GLP-1 agonist drugs, I don't think there's anything wrong with that, because for some patients, it is the right choice. It is only FDA approved for certain patient populations. So make sure to talk to your healthcare provider to see, is it the right choice for you? And then if you two decide as a team that it is the right choice, think about what you can do to support your health, and more specifically your muscle health, with thinking about supplements like omega-3s and Fortetropin, but also thinking about how you can eat better and keep up your movement in a way that excites you.
Very good. And one last question, where can we find more information? What is that website again?
Yes, so if you want to find more information about the studies that I mentioned today, or just learn more about how to safely take GLP-1s, you can go to myosmd.com. So that's myosmd.com.
Very good. Thank you so much, Dr. Swathi. That was a lot of good information. Thank you so much.
Thank you so much for having me.
You're welcome. And thank you for joining us. This has been A Closer Look.